And there we have Bali welcoming us back to the Now Morning Show, and we are going to be understanding what? Understanding abdominal pain. And for that, we have the Medical Director and CEO of the Freeport Medical Centre, Dr. Rohit Das. Thank you so much, sir. How are you doing?
I'm very good this morning, and I'm really happy to be here. Thanks again. And I would like to say good morning to all the viewers of the morning show this morning.
And we are always glad to have you. I want to start off, please, because if like me, it's the first time we're having this conversation, because I've seen you in your threads and stuff, but give us a little basis about the Freeport Medical Centre, please.
Definitely. Freeport Medical Centre is considered to be a one-stop medical centre where we are located in Freeport, next to the Freeport Police Station, 4 buildings down. We have considered ourselves to be providing affordable and accessible health care to our citizens. We provide services starting from doctor visits, a state-of-the-art diagnostic center, including all the diagnostic services like x-rays, blood tests, ultrasound, CT scans, even colonoscopies, calcium scoring for heart and so on. We focus a lot on treating chronic illness, screening for cancer, and we do have a special unit dealing with preventative care medicine. All right. We also deal with dialysis. We are one of the largest dialysis centers in Trinidad and Tobago, and I push my staff to run the center with our motto of taking patient care to the next level. And that basically our motto means that patient coming to us not well, and after they go through the process of seeing the doctor and having the treatment, they are a state of wellness. So that next level is where we are proud to be, taking care of patients. And very important, and before I stop here, is that we also give back to our community by having free clinics on Wednesdays and Fridays from 3 p.m. And we connect with our community by having community outreach programs.
So taking that service to the next level, looking at the fact that you engage with the community, and speaking of the community, I think it's fabulous in that location, because sometimes people say, well, Freeport, but that is so close to the flyover,
yes.
And you can get it whether or not you're going
north
south,
yes.
Or you can get it whether you're going north, because the police station is right there, and if it's 4 buildings from the police station, that's fabulous, yes. And a really nice location. But how important is it that you're able to consider yourself a one-stop shop? Because I think sometimes people might find themselves, okay, well, I need this test, so I have to go here. I need this test, so I have to go there, as opposed to just being able to get it at the Freeport Medical Centre.
That's a very amazing question. When we started off 20 years ago, we saw the need for services in the area. At that time, there were just only 2 other doctors. I don't know if you remember Dr. Hamza Rafiki was an old politician. So he was one of the doctors, Dr. Sant and myself. And at that time, there was a growing community. People were coming to see the doctor, and when they see the doctor, they have to go either San Fernando or Port of Spain to get sometimes an ultrasound. Well, even a CT scan, you were not able to get that in Central. And that's where our aim was, to provide a one-stop shop where patients could come, see the doctor, get their tests done, and be diagnosed properly. Remember, the purpose of a test is to make the proper diagnosis. And that conceptualized, and we could continue growing and growing. And, we were the first, we were the pioneer for the CT scan in Central. Freeport was the first center that established a CT scan department. And as I said, we are the largest dialysis center. Dialysis, as you know, is very important for patients with diabetes and kidney problems and so on. And we are also a certified center in Trinidad providing dialysis.
I think that's something that's important as well, because sometimes you might have individuals who, this is their sweet spot in terms of the time that they'd like to come, but because they don't have enough facilities, they're not able to get dialysis at that time. But apparently that's not a problem at the Freeport Medical Centre.
Not at all.
But we're gonna start to talk about abdominal pain, because we haven't started there yet. But some of the causes of abdominal pain.
Yes, yes. You know, coincidentally, while driving up to the studio this morning, I was thinking, you know, what is the best way, if you ask me that question, how to answer it in such a way that I be very thorough, I don't leave out any major causes, and at the same time comprehensive so that our listeners could understand and get a good idea what are some of the major causes and how do you really, you know, diagnose them. So I choose to go along the anatomical approach so that I would not leave out any major causes, right? In terms of the abdomen, it's a part of the body that is located between the diaphragm muscle and the pelvis. And within the abdomen, there are numerous organs, and in fact, very importantly, any one of those organs could cause abdominal pain. So let's start with the part of the digestive system, the stomach, the gallbladder, the liver, the pancreas, the small intestine, the colon, and of course that little appendix attached to the sigmoid colon can cause abdominal pain. Then part of the excretory system, which is the kidney and the ureter, that tube that connects the kidney to the bladder, can cause severe abdominal pain. You have the adrenal gland, which is located above the kidney. And then inside the abdomen, you also have the blood vessels, like the aorta and the arteries and veins. All right? And covering the abdomen, of course, you have the muscles, which, of course, sometimes could cause hernias and stuff like that. So any one of those organs, anyone can cause abdominal pain. And it has been established that between 10 to 12% of patients attending the emergency department comes with a complaint of abdominal pain. So it's a very common problem, not only in Trinidad, but worldwide, where people have different issues in the abdomen, and the first symptom presenting would be abdominal pain.
Looking at the amount of people who present with abdominal pain, what are some of the things, red flags, factors that you suggest that someone should check it out? Because I can imagine you tell auntie, you tell granny,
yes,
my belly hurting.
Yes.
And the first thing they might tell you is gas.
Yes.
Let me make some tea for you.
Yes.
So what are some of those things that say, no, this is not just gas, let me get this checked?
Yes. What we call gas is, you know, like in medical terms, gastritis. Gastritis is where the acid in the stomach start building up and start causing a crampy feeling in the stomach, right? But coming to that, the way to approach that is I will choose some of the major causes and just tell, you know, let the viewers know how it is that we go about diagnosing them and what is our approach. One of the most common causes of abdominal pain would be peptic ulcer or stomach ulcer problems. And that generally presents itself with pain in the upper abdomen, like just underneath the diaphragm muscle in the center. It's generally mild and then progressively gets stronger. It starts off as a dull pain, and then when it gets bad, when it develops into an ulcer, it becomes a sharp, stabbing pain, piercing your stomach and sometimes feeling it to the back. So it's a severe type of abdominal pain, peptic ulcer. The second very common cause would be gallbladder and gallbladder stones and infections. Again, this type of pain starts in the right upper quadrant, in the right upper area. It's generally colicky, starting mildly and getting stronger and stronger. If there's a gallstone and it blocks the bile duct, then of course bile will not be able to empty and patient will get jaundice. So you see the yellowing of the eye. That's an important flag. So you look for yellowing of your eye, and sometimes your urine gets dark. So doctor will test for your urine, and also of course we can do blood tests for your liver and stuff like that. In terms of your kidney, which can cause severe pain, I don't know if persons would know patients with kidney stones, but the pains can be excruciating. So it starts off again colicky, but generally in the flanks, because the kidneys are located to the back of the abdomen, known as the retroperitoneal area. And it starts off generally in the flanks, and it comes across like if it wants to go into the bladder. So it wraps around. Pain again starts colicky, starts off weak, and gets stronger and stronger. And that type of pain is associated with blood in your urine. So when you go to the doctor, when you come to us, we would test for urine and we would look for blood to see if there is a blood. Of course, appendicitis, again, very serious problem. Serious pain starts off weak like a dull pain, but on the right side, basically to the lower side, sometimes it can start around the navel, but generally, again, builds up and gets stronger and stronger. Appendicitis, however, is associated with fever and vomiting. So patients, and then it gets very severe where you can't even touch the belly. It is so strong, right? And of course, other causes like pancreatitis, again with fever, we do a blood test. And a very important cause of belly pain, which we must check for, is of course cancerous malignant lesions in the belly, generally in the colon. And of course, we look for blood in the stool, and you will have to, of course, do a colonoscopy, CT colonoscopy, to diagnose cancer of the colon. So blood in the stool, blood in the urine, high fever with appendicitis, jaundice with gallstone, kidney stone, and cholecystitis. Another important cause in Trinidad, and generally too, if we are looking at persons who drink a lot of alcohol, alcoholism, hepatitis and cirrhosis of the liver. Hepatitis presents with pain in the right upper area of the belly, and of course associated with jaundice as well too. So you look for jaundice.
Mr. Das, no, Dr. Das, right now you're sounding better than Google's call, and I'm sure that people will be replaying this just to get all of those symptoms. And once again, this goes back to the point that Freeport Medical Centre can test for all of these things in terms of trying to come to a diagnosis of what the actual issue is. But how does lifestyle play a part? So we've come to Freeport Medical Centre, we've found out what the issue is, and we're getting treatment for it, but we're also having our own responsibility. What are some of the ways that our lifestyle can affect abdominal health?
A very good question again. I like to keep my advice simple to my patients, and similarly here I would keep it simple. Generally speaking, my advice would be along healthy lifestyle. And in terms of eating, we tend to tell patients, try to keep away from too much of acidic food and drinks. Things like very, very spicy foods, vinegar, people use a lot of vinegar, lime and lemon juices and so on, adds to the acid of the stomach and then starts to erode the lining of the stomach, which is what starts off the gastritis and, of course, develop into an ulcer. So therefore, we recommend that you eat smaller meals, but more often. So you're making sure you feel satiated, you feel comfortable, but you're not eating meals spaced out, and there's a period where the stomach is empty and the acid gets an opportunity to start eroding. Of course, healthy living, drink at least 10 to 12 glasses of water on a daily basis. Keep away from too much of oily and fatty foods, and especially red meats. And of course, regular exercise, which we would promote healthy living. In terms of specifics like hepatitis, there's a vaccine that you could avoid getting hepatitis B. And please get your vaccine for hepatitis because that could avoid liver infections. In terms of, that's hepatitis, and then in terms of persons with cancer, there's a lot of screening that when you reach the age of 50, persons should start screening, which we provide at our center. So we provide healthy packages for heart, cancer screening, etc.
And there's so much more information that we can get if we go to freeportmedical.rdgrouptt.com. Dr. Rohit Das, thank you so much. Abdominal health and so much more.
Yes.
So we thank you for the information, and we thank you for staying tuned to the Now Morning Show. We return after this.
Yes.